And I see this a lot too in practice. This is a more of a just an observation than really a scientific statement. Is that when I first got in practice 40 years ago, I can't remember any men coming to me with erectile dysfunction issues. Just didn't happen. As time went on, one patient, two patients, I see maybe 5 or 6 patients a week with erectile dysfunction. I had a patient come in the other day, and he was 45 years old, ED. 80-year-old, 70-year-old, maybe I can see it, but when I'm starting to see it in 40-year-olds, I've had a guy come in 28 years old, ED. Why are they not functioning? Something's wrong. And it's just an observation on my part, but I'm seeing it a lot more and more. And men feel very comfortable coming to me with health issues. I get all sorts of health issues. And they come to me and say, Doc, what can I do naturally? Well, we can give you things like nitric oxide support, supplements that increase circulation. We can check the nerve supply in the low back, see if there's a pinched nerve going into the organs. We can look at your diet to see if you have a diet that's conducive or possibly causing clogged arteries. We can give you home therapies to use, that you can pump things up to try to get the muscle stretched out and moving again. But there's something more universal. And my feeling is that men are being exposed to these endocrine disrupting chemicals more and more, and it's becoming an issue. And again, I have an answer for you, which I'll give you in a little bit, but men are going to have to take steps to do something about it. And unfortunately, I find that most men aren't doing anything about it. They have pills now. You watch a commercial, right? A little blue pill solves the problem. 50% of men don't respond to the little blue pill. And 2 years, for the men that do respond, 2 years after taking it, 50% of them, it doesn't work anymore. So you can do injections. Well, injections might work, but every time you put an injection in there, you create scar tissue. Scar tissue can affect function. And over time, you're treating the symptoms, you're not treating the cause. And this is just one function of the body. What about the heart? What about the brain? What about the blood vessels? What about the muscles? All these things are being affected by these endocrine disrupting chemicals like microplastics.